The endocrine or hormone regulating system is an intricately connected and dynamically balanced system. Much like the art of rock balancing, if one rock is knocked off center, the structure cannot maintain its balance. When any one of the endocrine organs goes out of balance, the rest go out of balance to try to create a new dynamic balance. Reestablishing the healthy balance is sometimes difficult, but it can usually be done. Endocrine glands secrete their hormones directly into the bloodstream. Your endocrine system is made up of the hypothalamus, pituitary, pineal, thyroid, parathyroid, thymus, adrenal glands, ovaries or testes, and pancreas. Other organs and tissues in the body that secrete hormones and are considered minor endocrine glands include the heart, gastrointestinal tract, kidneys, skin, adipose or fat tissue, and during pregnancy, the placenta. Blood sugar issues culminating in diabetes have become epidemic in the developed world. According to a study published in the Journal of Clinical Investigation, September 2016, the consumption of fructose, or the sugar found naturally in very small amounts in fruits and vegetables, and added in high concentrations as high fructose syrup to consumables like soft drinks, candy, and many processed foods, triggers the liver to create a protein that instigates the formation of glucose. When glucose production exceeds the body's immediate fuel needs, it gets converted into fat. Your body must produce enough insulin to latch onto the glucose to escort the glucose into your cells. When your cells are unable to accept this glucose insulin package as a fuel source, it is called insulin resistance. It's important to remember that even slender people can have issues with glucose imbalance and insulin resistance. How do you know if you are at risk for insulin resistance or type 2 diabetes? See how many of these risk factors you can check off. Is your BMI over 25? If you don't know for sure, use this online BMI calculator. If you're a male, is your waist over 40 inches at your belly button? Or if you're female, is your waist over 36 inches at your belly button? Are you over 40 years old? Are you of Latino, African American, Native American, or Asian American ancestry? Does anyone in your immediate family have type 2 diabetes, high blood pressure, or arteriosclerosis? Have you ever had high blood pressure, elevated triglycerides, low HDL, or arteriosclerosis? If you were a female, have you ever had gestational diabetes or been diagnosed with polycystic ovarian syndrome? Do you have acanthosis nigricans? Do you have skin tags? Do you have sleep apnea? More yes answers equals a higher risk factor. Many people are lulled into a false sense of security by thinking, I'm younger than 40 and I'm not overweight. We are seeing a new epidemic of people we describe as skinny fat. The medical term for skinny fat is metabolically obese, normal weight. These people carry visceral fat or excess fat tucked in around their organs in their gut, but they don't carry much fat anywhere else. Hence, they appear skinny, but they are also under-muscled. Their at-risk levels of fat come from a faulty diet and a sedentary lifestyle. Being skinny fat actually carries more serious health risks than being obese. Skinny fat is very common in people who are insulin resistant. Insulin resistance is the precursor of type 2 diabetes. Insulin resistance and type 2 diabetes increase many health risks, including abdominal obesity, elevated cholesterol, hypertension, heart disease, fatty liver, PCOS, arteriosclerosis, coronary artery disease, and stroke. The amazing thing is that all of these imbalances can be positively impacted through diet and exercise. What do you need to do to correct these health problems or to prevent them? Well, first and foremost, get a diagnosis. Your medical doctor can order various blood tests, which, when coupled with your symptoms, can identify where you are on that blood sugar spectrum. If your tests prove that you are skinny fat, or that you have insulin resistance, or that you are type 2 diabetic, here are some lifestyle changes your doctor will probably recommend. Eliminate refined sugar and artificial sweeteners in all forms. No soda, no candy, no alcohol, no juice, and most prepackaged foods are gonzo. Number 2, eliminate refined grains, so breads, crackers, and pasta that are made with white flour, and get rid of white rice. Number 3, eat non-processed protein, so get rid of the sandwich meats, but eat real chicken, fish, beef, lamb, legumes, nuts, seeds, 3 to 4 times a day. Number 4, eat lots of leafy greens, 3 to 4 ounces by weight daily. Number 5, eat other low-carb vegetables, 3 to 4 large handfuls every day. Number 6, drink water. Number 7, keep your fruit intake down to 1 serving per day. Number 8, get regular daily physical activity, at least 30 minutes of brisk walking every day, preferably after a meal. These changes are good for everyone, not just people who have a diagnosis of skinny fat or insulin resistance or type 2 diabetes. How else could you know if you are at risk or if you are percolating a blood sugar problem? Join me on January 3rd for a webinar where I will introduce you to some iridology and sclera indicators that suggest whether you've got a genetic risk or whether you could be potentially brewing a problem right now. The registration links and information are in the description for this video.